Your left from New Zealand, Dr. Stuart Jeffrey, who's the Director of Public Health. Next to him is Zhang Yang, Deputy Director General of the Department of International Cooperation at the Chinese National Health and Family Planning Commission. In the middle, our two health ministers from Malaysia, Dr.S and from Tonga, Dr. Syed Kyokala. From Vietnam, Dr. Huang Tran, Deputy General of the Department of International Cooperation at the Health Ministry. And last but not least, next to me, from Japan, Dr. Hiroyuki Yabaya, the Director of International Cooperation at the Minister's Secretariat. Well, thank you very much for being here. We heard what Vivian outlined for us. She provided us with a skeleton. And what we'd love for you to do now is to colour that in with content, drawing on your insights, but also your prediction as to what could come next. So I want to start off with a very broad question that gives you a lot of room to move around in. Very, very quickly, and we'll start off with Malaysia. Minister, what does health mean to you in the context of the SDGs?
Thank you. Thank you, James. The mic was in the safe custody of Tonga. Well, to me, from a broad perspective, I have a very liberal understanding of SDGs. And I think all the 17 SDGs work towards the creation of a human habitat which will enable a very high quality life based on the principles of equity and sustainability, and that in its totality actually contributes to the overall being of what we call a healthy life. So if you look at the SDGs per se, if we are not too terrain or territory obsessed, that health must be a territory by itself, looking at it in a very broader concept, it actually works towards the development of a global environment which is enabling, contributory towards the development of what is called broadly health.
Okay, Stuart, when you think of that global environment in that very broad space, what do you see for health within this new architecture?
I guess it really starts where you begin, or where do you begin looking at it? I think at the coalface, at the service delivery amongst people, it will look much the same as it's always done. When I first looked as a doctor at SDGs, I thought, you know, Moses only got 10 commandments from God. And here are 17. And 2,000 years later, we actually haven't fully implemented all 10 commandments. And so I quite like the millennial goals because I thought that meant we had 1,000 years to deliver them. And to find that we've only got 20 years is going to put a lot of pressure on it. So I think that at a consumer level, an operational level to begin with, SDGs are not going to impact for a long time, but at a conceptual level and a policy level, to quote a recent Disney song, many of our doctors and policymakers are going to have to let it go and take a much bigger view that, I certainly agree. I think I look at the SDGs now and I go, these are all about health. It's not that there's just one. This is all about health. The question is, how do we convince our economic colleagues and our social welfare colleagues and our industrial colleagues that actually this is about us? Or do we stop calling, should we put aside the idea of one health and health in all policies and just simply say, hey guys, this is actually cost-effective interventions at multiple different levels. And then everyone will agree with it and we can go on and implement it.
About health, but other goals, for example, goal number 2, poverty reduction, food security and nutrition, climate change, water and sanitation, that's all related to health. And going back to our story, Vietnam is successfully in implementing MDGs, and we are now moving towards SDG. And we think that the most important for us is to sustain the achievement that we have done in the past and build up from this achievement and move forward to a more comprehensive and holistic approach so that our health can be attained in a higher level.
Within that, of course, there are a whole range of social determinants. When we fix education, when we fix gender, when we fix climate change, poverty, hunger, all that can help meet health before it gets to the door of health. So where do you think you can fit into this, and what would you be talking across government to your colleagues and what they can do for you?
I think this brings us to the premise that the issue of health is not purely the responsibility of the Ministry of Health alone, but it's a multi-sectoral component where the whole of government has to work as one entity towards the creation of health-enabled environment. And I think the SDGs per se address that. I think when you look at SDGs, we have to give very great importance to the term of sustainability, because the entire philosophy of the SDG is based on recognition by the global community that hitherto whatever we have done has affected the long-term sustainability of our continuous existence in our habitat. And we have to make a major paradigm shift in the way we approach our whole element of development to ensure long-term sustainability is enabled. So in that long-term sustainability being enabled, health becomes a very paramount component of it, because as you work towards a sustainable long-term environment where man can live for many more centuries to come, that will be something which will positively enable health. So in short, right, after answering your question, I think we have to broaden the concept of health in government itself from not being confined to the territories of the Ministry of Health, but take it beyond as education, as poverty eradication, is the enabling of a human settlement, which is health enabling, agriculture being transformed to be related to nutrition, and many other components which will actually help creating the health enabling environment as in the government as a whole, and through that, of course, reduce the burden on the health ministry itself as the direct provider of health.
Well, I'm excited when I hear you say that you want all your colleagues to understand that delivery on health is a shared responsibility. I think everybody in this room would agree, but I think everybody in this room probably has a question right now, and there's a question mark going, how do we do that? Now, all your other colleagues are saying that you should be helping us deliver on finance or on justice, but there is a way that it can be achieved. Zhang Yang, you've got one example about how you can integrate this political incentive within the national 5-year program. How does it work on the domestic agenda?
I think that first of all, if you want to bring into the play of the non-health sectors, then I think that one of the most important things is that the health sectors, you have to take initiative. And to take the initiative to guiding and coordinating the various efforts to work together for your health targets. And for instance, for SDGs, now we have a lot of discussions on this, but how to integrate the SDG goals and targets bring it into the government and national strategies. This is very important. This is what the health sectors we need to do. Now we are trying to make our efforts to bring those targets into the overall, we call the next 5 years plan, next national 5-year plan. Then to integrate it with the national strategies, that will more effective to realize the related health goals.
Okay, so you embed this vision within your own domestic agenda.
During the MDGs, we just take some of the goals from MDGs and bring it into the overall national plan. Then it shows very effective, because like poverty alleviation in China, we are the countries that are first to reach the MDGs goals ahead of time in terms of the poverty alleviation. So it's a very effective way. And now we're still working on this and try to bring the SDG goals into the next 5-year plan.
Okay, so China delivered 5 years ahead on the MDG for poverty measures. Our next one comes from Gabriel Leung, the Dean of the Medical School at Hong Kong University.
Thank you very much. I just wish to ask the panel, you're all from governments who have a very good track record of improving health and global health for not only your own citizens, but others in the region and around the world. It's often said that what cannot be measured cannot be improved. quite unlike the MDGs, which are very explicit and often, in fact, almost always quantitative targets, simple to understand targets, the SDGs have so far faced the challenge of perhaps being a little bit less precise in its goals than the MDGs. I know that there is, in your own ministries and around the world, attempts at quantifying some of these 169 targets or goals and then turning them into something that is more quantitative, that can be turned into numbers and then measured and monitored. Now, could you tell us how, in your own work, this is being done, and do you think it is possible with 169 targets to have a common data set, while you're also, of course, receiving similar requests from other supranational efforts, but most notably the UHC? So how do we have a common set of metrics to inform the UHC efforts and the SDG efforts? Thank you.
Minister from Malaysia, would you like to take that first?
Thanks, Dr. Leong. One, I think there are areas in which the health SDG, I think defined targets have been stated. For example, reducing the maternal mortality rate to less than 70, reducing the neonatal mortality rate to less than 12, and reducing premature deaths due to NCDs by 30%. So there are areas in which well-defined targets have been put in the SDGs, whilst there have been broader targets which have been put for the other areas. I think that leaving that broader targets probably will leave it to the nations itself, according to their level of development, to put well-defined targets so that they can move along the directions which are set by the SDGs. Overall, if you look at the SDGs itself, if a country seriously takes attempts, leaving aside even the other 17, you look at the health SDG 3 alone, with the 9 targets which have been related to it, and the final target which involves health financing and manpower development and all that. If you look at the overall, if a country actually works towards achieving those goals, the net result of that will actually be the development of health systems which are resilient and responsive, and putting in health infrastructures which are right, developing the correct kind of manpower in the health sector. And this all directly or indirectly actually will help strengthen the whole system of health itself, although the targets are few. For example, to achieve a good reduction in mortality rate, it goes back to your public health system and how you have got a system which deals with antenatal care. So all of that collectively will contribute to a health system which is resilient, responsive, and adequate to meet the overall targets. In Malaysia, we have got a monitoring mechanism of key performance index, in which we actually define targets for the ministers and the Director General, where say you have to reduce the number of TB cases by so many, you have to reduce the number of malaria cases by so many, you have to make sure that the consumption of tobacco is reduced by. We have our defined targets within our system, which we actually very seriously and religiously follow to ensure those targets are achieved, and identify what obstacles are that towards which doesn't enable us to achieve that, and try to manage those obstacles. So I'm sure in different countries there will be different methods to achieve what you actually rightfully asked. Thank you.
So we can walk out of this room and leave Guam and do one thing differently now that we have the SDGs. Stuart will start off with you. One idea.
That I've got knowledge and you've got knowledge, and together, if we pool our knowledge, the people can do well. And that's what it's about cooperation and sharing information.
Janya.
Well, I think we're not only, this kind of forum discussion is not enough. We need to make decisions. And make decisions is not enough. We need to take actions.
Right. I think governments have to take cognition of the fact that health is not an isolated agenda, but is a consequence of the successes or failures of the other agendas of the government. So it's essential that the aspect of health be incorporated in the entire government agenda, so that that will give rise to an overall health enabling environment which will provide for the achievement of the other aspects of economic and productive development.
Thank you very much, Minister. Thank you to everybody. I think we heard some common words there, which were togetherness, health for all, and partnership also came from the Tongan Health Minister. That wraps up our session here in Guam on the SDGs. Of course, it's just the first component as you look at all the 17 goals and the dozens of targets or hundreds of targets that lie there from within. But also a great thanks to WHO and to Dr. Shin for, as we say, creating this space and this platform for us to come together here and specifically on this. Thank you very much.